ONS, or occipital nerve stimulation, is the placement of a small percutaneous wire or paddle electrode over the greater occipital nerve in the subnuchal region, and then connected to an implanted pulse generator placed in a subcutaneous pocket in the infraclavicular chest wall, abdominal or gluteal region. It is thus a fully implanted device, remotely controlled by the patient with a small handheld programmer. The device, when active, sends an electrical current to the electrode, which then stimulates the greater occipital nerve, producing a pleasant paresthesia or tingling in the distribution of the greater occipital nerve, i.e. over the back of the upper neck and head, sometimes as far forward as the frontal region. This stimulation is associated with an improvement in headache control, such as the number of patients with a 30% or more reduction in headache intensity from baseline, or in the number of headache days. Patients often use the device continuously for the first months after implant, and then with a reduction in headache burden, they often settle into a routine of intermittent use, as often the headache becomes episodic again. The mechanism of action remains yet to be fully elucidated, but is thought to involve pain relief not only through the gate control theory of pain, but also through activating the connection between the occipital nerve and the trigeminal-vascular system. Nociceptive afferents from both the trigeminal nerve and the occipital nerves partially converge on the same second-order neurons in the trigemino-cervical complex, and thus to a final common pathway to higher centres for cephalic nociception. Kovacs, using functional MRI in a patient with an occipital nerve stimulator, showed significantly decreased activity within the bilateral primary visual, auditory and somatosensory cortices, and in the amygdala. Significant increased activity was observed bilaterally in the thalamus, frontal and parietal areas and the cerebellum, so it may relieve pain through multiple mechanisms.